Okay, good morning, everyone. Will the clerk please call the roll?
Good morning. Calling the roll for the Monday, September 12th Board of Control meeting. It is 11 a.m. We have Dale Miller.
Here.
We have Nan Baker. We have James Boyle serving as the alternate for Pernell Jones.
Present.
We have Nicole English serving as the alternate for Mike Dever.
Here.
We have Mike Chambers serving as the alternate for the for the executive.
Here.
We have Lee Tucker serving as an alternate for the fiscal officer.
Here.
And we have Paul Porum.
Here.
We have a quorum.
Okay, thank you. Next on our agenda is the minutes of September 6th. I'll make a motion to approve. Do I have a second?
Second.
Seconded by Ms. Nicole English. All in favor, say aye.
Aye.
Opposed? The minutes are approved. Next is public comment.
No public comments at this time.
Okay, let's move on to our first item, please.
Our first item is BC 2022-539, Department of Public Works requesting to amend the board approval dated September 6, 2022, which approved an amendment to contract to DLR Group Incorporated, doing business as DLR Group, Westlake Reed Leskowski, for programming services for the Justice Center Complex project by changing the amount not to exceed from $343,880 to a not to exceed amount of $382,280.
Good morning. Paul Porter, Director, Department of Purchasing. I'm going to take the presentation on this one because this was a clerical error in the agenda last week. There are two components to the pricing of this amendment. One is a lump sum payment in the amount of $343,880, which is the dollar amount that was approved at last week's meeting. But there's also an expense amount that's part of the amendment for reimbursable expenses, primarily associated with the travel that's going to occur as a result of this contract. And that total is $38,400, which is how we arrive at the revised total of $382,280. Again, there's no change to the amendment itself. All the discussion that occurred last week is still applicable. It was just an error in the way we put it on the agenda. So apologies for that, and that's why I told Nicole we wanted to handle the presentation.
Thank you, Paul. Any questions on this item? Please.
Certainly understand clerical error happened, full agenda, lots going on. My objections remain the same, though. 38,000 doesn't help to increase. So, but I do appreciate when mistakes happen, and of course, we understand.
Okay, thank you.
Thank you.
Seeing no further questions or comments, I will make a motion to approve this item. Do I have a second?
Second.
Seconded by Ms. Nicole English. All in favor, say aye.
Aye.
Opposed? We got one opposed. The item is approved and passes. Next item.
Next item, BC 2022-540, Department of Public Works recommending a payment on a purchase order to Northeast Ohio Area Coordinating Agency in the amount of $153,835 for an annual membership dues for the period July 1st, 2022 through June 30th, 2023.
Nicole English with Public Works. This is our annual dues payment to NOACA. As soon as it came in, I believe the end of July is when we got the bill, we put it through. So while it shows it's late, it's really an annual payment and they will take it anytime during the year. I did provide some further backup. It is calculated based on the latest census, and ours this year did decrease a decent amount because Cleveland had been pulled out. Now they are paying as kind of a separate entity. And I gave a link to NOACA's presentation that they gave that has more information than you'd ever want on how they divide up the payment.
Thank you, Ms. English. Questions from the board? Mr. Boyle.
Can you off record or off here, just get me what the dues were last year? It's annual, right?
Correct.
All right, yeah, that's fine. What?
Okay.
I think we went down by 60,000 or so, but I'll get you the exact amount, yeah. And Cleveland picked up the rest.
Okay, thank you. Seeing no further questions, I will make the motion to approve. Is there a second?
Second.
Seconded by Mr. Boyle. All in favor, say aye. Aye. Opposed? The item is approved. Next item.
The next item is the Department of Information Technology submitting an amendment to a contract with Woolpert Incorporated for base mapping services for stormwater, sanitary, road, and bridge projects in Olmsted Township for the period August 30th, 2021 through August 29th, 2022, to expand the scope of services effective August 11th, 2022, to extend the time period to August 29th, 2023, and for additional funds in the amount not to exceed $22,000.
Good morning, Kristen Caspar with the Department of Information Technology. This request is basically for a one-year extension for our base mapping. The base mapping does support the Department of Public Works for stormwater, sanitary, and road and bridge. This amendment will provide services to the current projects.
Thank you, Kristen. Questions from the board? Seeing no questions, I will make the motion to approve. Do I have a second?
Second.
Second by Ms. Nicole English. All in
you.
favor, say aye. Aye. Opposed? The item is approved. Next item?
The next item is BC 2022-542, Sheriff's Department submitting an amendment to a contract with TAC Computer Incorporated for mobile data terminal and records management system software maintenance and support services for the period January 1, 2022 through December 31st, 2022, to extend the time period to December 31st, 2023, and for additional funds in the amount not to exceed $14,209.38.
Chris Costin, Sheriff's Department. This is just a renewal of our record management system that we have in place. Our law enforcement officers use these to communicate with Streeter Valley Dispatch. It helps locate where the deputies are. They report to them through their incident reports and all that. So we're asking for a one-year extension.
Thank you, Chris. Questions from the board? Seeing no questions, I'll make the motion to approve. Is there a second?
Second.
Seconded by Ms. Nicole English. All in favor, say aye.
Aye.
Opposed? Item is approved. Next item.
The next item is BC 2022-543, Department of Health and Human Services submitting an RFP exemption, which will result in a grant award recommendation to the Center for Community Solutions in the amount not to exceed $475,000 for outreach, education, and support services for the reproductive rights of women throughout Cuyahoga County, commencing upon contract signature of all parties through April 30th, 2025, and recommending an award and enter into a grant agreement with said RFP exemption.
Good morning, Sabrina Roberts with the Department of Health and Human Services. I hope you all are well. This is a grant with Community Solutions to establish a planning process around reproductive health.
Okay, Sabrina, thank you. Questions from the board? Please.
Okay, and thank you for your proposal. And that was a quick overview of probably a very involved proposal. You know, I was a little concerned here, and more than a little, I was concerned about the committee that is going to be hearing the 2022-0008. And that is also related to this topic. Your proposal here in the backup also says it assists with logistical support such as transportation out of state, hotel accommodations. So those are things that could be talked about in committee. You never know how a committee process can evolve into more than what is just written, but it just seems that these two proposals are too closely related. Is there any comment you have on that?
Sure. The necessity we felt to bring this forward was to begin the planning. We understand that you and the council can discuss the proposed ordinance, but this was a way to begin the planning. Community Solutions has a long history of providing this kind of public-private partnership think to make sure not only with adoption agencies and other key entities around town to really begin to understand where our gaps will be. And to start that, we didn't want to wait months to get that started. John has administered the AIDS Funding Collaborative work you're familiar with HIV and AIDS. They created the groundwork, public-private partnership around early learning, and this was high stakes enough that we felt we needed to start something. There is a budget, but it's subject to move around with obviously them coming back to us. The transportation piece is only one component of broader planning around all those aforementioned statements I made. The group that's going to get together, we've talked to Gun Foundation. There's a lot of players in town circling around this issue. We have right now residents who don't understand what this legislation means. And to us, there's a health access and health imperative that we begin to put folks in a room on the ground to answer that bell of people understanding, what does this mean? Can I get an abortion? Can I not? None of the funds, grant fundings, will be used in any abortion procedure, including medication abortion, legal or otherwise, because there still are legal abortions through 6 weeks. None of this money will be used for that. This money will be used for all those planning and understanding those gaps. And we had 21,000 abortions in the state last year, 6,500 of which came from Cuyahoga County. So we thought this was high enough alert that we begin the planning process with partners.
Well, if I may, I appreciate that. I don't think we're months away. I mean, it's on the agenda already, and it's going to committee. So I think that depending on how passionate committee members are, of how they may, push it forward pretty quickly or not, is in question. I don't like to see us working in silos, you doing one thing and we're doing something else. It's good if the administration and council can work together, perhaps come up with a larger, broader picture of what is needed. Again, I think these are just too closely related without giving perhaps a committee a chance to chime in to perhaps help what it is that you're doing and maybe even be a partner of what it is that you're doing. But right now, offering or asking for, what is the amount? $475,000 is a considerable amount of money. And like I said, it's closely timed with what is happening on county council also in those deliberations. And I'm concerned that we are working in silos here and not working together to come up with one, perhaps, proposal that would be welcomed by all.
Mr. Chairman, if I may,
Please.
because obviously the law department was pretty closely involved in both of these things. The ordinance and this grant agreement are two, to me, very different things.
Okay.
The ordinance is about discrimination and creating a prohibition on discrimination based on decisions that women make regarding reproductive health.
Right.
This, on the other hand, is a grant to allow the Centers for Community Solutions to provide services to women who are making decisions. So they're two very different things.
Yeah, I understand what you're saying. I'm not sure that they are. I think one complements the other or perhaps doesn't complement the other. I would think that we'd want to know what it is that county council wants to outline as to what it is they think discrimination is before we move forward on procedures to, I was sure you would use this council proposal, I'm losing the number here, that you would reflect back on that and say, well, this is also in support of what council has done. I just don't think they're far enough apart. I think I understand your differences, but I do think, too, that one would play off the other if moving in the same direction and hopefully not work in silos or disagree. I mean, what if we find there is no discrimination and yet we're moving forward on something that says there is, or the opposite, that there is discrimination? And I just think there's more conversation before we allow $475,000 to be granted.
Through the chair, Councilwoman Baker. I've been here a long time, and 20 years. When we, when we look at, we on the other side, HHS, we are using our policies and our practices to make good recommendations. We see a myriad of issues every day that come at us very, very fast. That is not taking away the discussion around discrimination. For us to work day to day with people constantly bombarding us with no information, it was our response to say people are confused. The quicker we get money out the door and get a toolkit together and help people understand what they can and cannot do to follow the rule of law and to protect their health care, that's what was important to us. I understand we need to work together and not be in silos, absolutely. But for us, this is the reasoning. This was more not a debate, but an answer to a call that we need to do something expeditiously. And whether one might think people are discriminated against or not, what we do know with health access, we have groups of people who, when they don't have information, they have worse health outcomes. We have groups of people who may not have the means to respond as quick as other folks. So it's in our understanding of Health and Human Services is to provide something expeditiously to people who may not have the means to get help right away. Whether it's a day or a week, we're a day or a week too late to me. So that's just respectfully.
In the 475,000, is that the entire total of what this program is, or
The
is there
entire-
other private sector money coming in?
And private sector they're making grants as well to different entities. We've been in constant contact with GUND. John Corlett is here. I don't have to speak for him, but he is here. We're looking for this to be the beginning of a private partnership that we've done 20 times over, that we know in this community, when we all sit at the table together and move in the same direction and row in the same direction, we get great outcomes.
Yeah.
So this is one of those things. There are reports that are going to come back to the county, notwithstanding to you all, to say, how is this money being expended? One of the first things out the gate is not travel, it is getting the information out correctly. People don't have the right information. It's not in formats they understand. So that is the imperative.
Why would you add then transportation and hotel accommodations? Why not include that right now and stay with your education and knowledge of what it is that you can help those that have those questions?
Because we always know there's one-off. There's always a one-off situation. We don't want anyone who doesn't have the means to be that one-off person, and this group that's going to form, they have to put bumpers, if you will, when you go bowling, bumpers around this. This is not here, John and Community Solutions, take the money and we're not going to see you again. This is constant monitoring. Anybody that has a contract under me, I constantly monitor. This is not I'll see you once a quarter. This is check-ins every week, every 2 weeks about what we're doing and making sure it's equitable, making sure we are servicing people from Bay Village over to Warrensville. I don't know, can't remember the A's of these, but all across the community. So I do understand that there is an ordinance, but I respectfully ask you to consider this for the actual action of it, to help people. And understand that there's not going to be, we're just going to start giving out transportation. They're not going to start giving out transportation vouchers. We have to put bumpers around that and make sure it's legal, make sure all of our ducks are in a row. But the biggest piece of this right now is to make sure people understand what this means.
And I hear you on that, and I think that's always good. I mean, you've done a great job in reaching out and making sure that people understand a variety of different things that we do here in the county, and that support we've always supported. I guess it just would be better, at least for me, if you're going to put in the transportation and hotel accommodations, which is more than just education, that we hold it until we have a chance, which is, like I said, on the agenda and referred to committee probably tomorrow. If not already referred to committee. I think it is already referred to committee.
And I don't know, because I just saw the ordinance.
Yeah.
Is there a funding component with your ordinance?
I don't know. If
No.
I don't,
No.
no, there's not a
No.
funding.
I think it's been referred to committee of the whole, but
Committee of the whole.
I don't know if it's on an agenda
Okay,
yet or
so
not.
it's already, and it's going to be before all 11 members. What would be the harm in waiting a week or two in order to, and maybe 2 weeks to have it go through committee of the whole and then referred to council and then have it passed? I mean, we're not talking months, as you thought we were.
But I have to, just in order of understanding, this wouldn't be on that agenda in order to pass. This would then have to come back and wait and do the normal,
Right,
process.
right, right.
So,
Well, if we hold it, it can go back on the next agenda, can't it?
We could make
Back in
it,
2 weeks. Or it would be back next Monday.
Yeah.
Or it could be back in 2 weeks after the council has had a chance. At least we have an indication after committee where we're going. Right now, we have no dialogue, no indication. We haven't had a chance to discuss it. This just seems like this should come after the fact, not before. Those are my feelings. And I hear what you're saying. Honestly, I do. And I know there's others that don't feel the same way as I do, and that's okay. But that's where I'm at on this.
do we have any other comments, questions? Councilman Miller, please.
I have a whole nother set of questions.
okay,
Uh,
I'll do my best to answer.
The first one is am I correct that this money is only for planning and not for services? This particular request?
This request is for planning and services by way of no abortion services, but services, there is a component if someone needed transportation, which is legal, out of the state, but not transportation to an abortion clinic or any care, nothing related to that. Service in that if someone needed to speak to someone to understand what they're reading, services meaning getting a toolkit out to providers, in that way, services, but not services of abortion.
And $475,000 seems to be a lot of money for a planning grant. Can you give me kind of a breakdown of what the money will be used for?
Sure. It's in the attachment here. So personnel, including fringes, 95,000 to spearhead this. You have legal, communications, and training, having people go out and train providers and groups around how, what is legal, what is not, and what is doable. Communications, that's providing that toolkit and training around what does this mean, what is appropriate, what is not appropriate, and what is not legal. The Patient Education Counseling Assistance Fund is the 278, I'm mixing up the numbers, 278,000. That is,
What was that item for?
that is for, the breakdown would be if transportation was needed out of state, if hotel accommodations were needed, and if childcare was needed, and of course not for people who have a childcare voucher already. So that, if I'm doing my math, was about $471, up to 500 folks. And of course, that is as needed, that this may take the whole full time or none. We don't know yet, but we wanted to have it in place.
And why is the contract for as long as it is going through 2025?
Just to give time for planning, working with the different partners to stand it up this year And we don't know how long or how many people until we start planning and hearing from the community around the issue. It's planning for up to 500 people. That doesn't include how many people we will connect with regarding the communications piece and toolkit piece. That's just merely out of that community assistance fund bucket. We're planning to reach many, many more people with the other portion of these funds.
And is this part of the list of ARPA items that were put forward by the executive and the council president in the series of press conferences earlier this year, or is this a later addition?
I don't know the answer to this question. I don't know if anybody else in the room does.
I'm not sure offhand, but we can check into that.
Okay, you can.
You want to come up, David?
David Merriman on behalf of the Department of Health and Human Services. This was not on the initial list because I think the Supreme Court ruling came out after the time that ruling, the list was developed. So it is an addition. And I know there was a question about can this item be held a week. I know that Sabrina Roberts, in her role as Assistant Director and Director of Health Policy, has really pushed to bring this forward for the justifications she's given. But at the end of the day, obviously, if the board needs to hold this a week, it's understood.
Well, let me see if the board is willing to hold it. I mean, is that our, does anyone feel comfortable moving forward, or?
Mr. Chair, I do have a question about the ordinance, though. I pulled up the committee of the whole agenda. This one's not. Other ordinances are 7, but ordinance number 8 is not on the agenda. So if that were to happen, it looks like this one was introduced 8-2 and referred to committee of the whole, but it's not on the following committee of the whole agenda. So I don't know, council would probably check, but I assume it wouldn't be able to go to committee of the whole until 2 weeks from whenever you're having that, whether you're doing that Tuesday or Wednesday, since the council meeting's Wednesday. Do you know if it was held from the committee of the whole agenda? Because that's a pretty packed agenda for tomorrow.
Honestly, I have not been briefed on it, so I can't really say. I know we have several committee of the whole meetings coming up.
Yeah, we have a
Yeah,
tight
so it
agenda.
could be on any one of those, but I don't know for sure, but
I can give a brief comment from a staffing perspective. I think your point, Paul, is correct, is that, I mean, the agenda, Councilwoman, as you said, is pretty weighty tomorrow in the committee of the whole on issues and topics that I think are really long-standing, important issues. And that is in all likelihood the rationale that this particular item wasn't put on there. But again, if I may, I don't know that timing issue, going back to Councilwoman Baker's comments, the timing of that hearing, I don't know is necessarily relevant to your desire to hold it.
So I would add that there is another committee of the whole meeting scheduled for the 22nd, which is a week from Thursday. But I suspect that at that meeting as well, that the issues of the jail are gonna predominate the agenda, and I would be surprised if this gets on the agenda. So my guess is because of the pressing nature of the issues relating to the jail and the upgrade of the convention center. I think if we say that we're going to hold this until the ordinance is heard in council, I think you're talking about an extended delay.
Okay, well, I mean, I'm willing to put it to a vote if that's what we want to do. So, yeah, please.
no, even if it's an extended delay, we're not talking still months. We're talking getting past some of the big issues that we have in front of us, which they're big. It's understandable. But we're still not talking months. And, you know, if you took out perhaps the transportation and hotel accommodations, which if I heard you correctly, 278,000 of the 475,000 is what you're putting aside for this. That's a considerable, you wouldn't be asking for that. That's a considerable amount of money that is anticipated to be used. So I think that's a big, I mean, you would be down to about 180, if my numbers are right, $190,000 ask if it wasn't for that. You know, perhaps if we could amend it to that, we might, I would be more comfortable with it, because it is all about education. There's no problem with that. It's the added, considerable amount added to the 470, included in the 475, that makes this something that I think you should hear what council has to say before moving forward.
So I'll ask Sabrina or John Corlett if they also want to speak. I know Greg started to reflect on this and recognize that there is these are separate issues. The ordinance and this proposed contract are separate issues and should, you know, be treated as separate issues. I do understand there's a relation on the broader national issue of the restriction of abortion. But I think from our perspective, it is a longer-term contract. It's been drafted to allow for this planning process to occur, but also to anticipate there will be the need for some support to individuals that are really trying to seek out what the best option for them is. And so I feel like, you know, the contract stands on its own.
If I may, that's my point was this grant has nothing to do with discrimination. Nothing to do with discrimination. It's about providing services. So the two are just two separate things.
I hear you, but I think to disavow the relationship between the context of the ordinance that's moving forward and the ask in this one is I get it. You're right. From a legal perspective, Greg, they are not related. But in terms of topic, I think you can certainly make the comment that they are. If I may, Councilmember, I guess I'm a little confused. And this sounds like it's an education piece, correct? I mean, is that what we're doing? Or that's what's being asked?
What we're doing, and I can call John Corlett because it's the grant with him. For all of our planning that has happened with HIV and AIDS, it takes quite a few people around the table to really get at the heart. Yes, a component is education and awareness, but the other component is being able to answer if something comes up. It won't be the bell curve middle, you know, please let me use transportation. It will be that one-off horrific situation that we want to respond to and be ready for.
I understand that, and that's where my confusion comes in. When you say that we're not talking about we're talking about talking about John Corlett's. We're hiring John Corlett's entity.
We as a community.
I get that, but we as a county are paying John Corlett to do this outreach work, which is fine. I don't have a problem with that. But one of the things that I do think is potentially available is the power of the pulpit of the executive. I mean, he issued a press release on this thing the other day, and if it is an education piece, can do this education during an interim period while there's some discussion about what the funding looks like and what pieces should be included in there. Because, you know, when I look at the responses that are provided, not just the responses, but the commentary in the backup documents. There is a great health need in Cuyahoga County to provide women of all ages, support outreach, education, and proper assistance. Well, I think, and again, I don't want to put words into Councilwoman Baker's, you know, and take her words, but I mean, the support outreach education I think is fine. When you get into the proper assistance, I don't know what that means. And when I look at, for example, the responses that were provided, it says that it's patient options, education, and counseling. And counseling troubles me. Not as a Jim Boyle, you know, how I feel about the issue, but counseling gets into a more different thing than just saying, hey, these are your options. And those are the things that I think I look at that I'm not saying I mean, I certainly have a belief system that would easily allow me to vote on this. But hearing from the council members that I work for, I mean, I think they have questions, and those are kind of what I'm asking. The other piece is, I really don't understand what the rush is right now if the law is in some fashion not wholly decided. And I'm not saying that it is. I mean, the Supreme Court has ruled, but I don't know what our state legislature is going to do. I'm not sure what handing out money now does. Yes, it gets a jump on it, but I guess if we don't know the status of the law, and there were some sort of comments from you, Sabrina, about, well, if need be, and those type of things, and those are the things that lead me to a lot of questions, I guess. So in any event, that's more of a comment than it is anything else.
To the chair and to Mr. Boyle. Yeah, I'm sorry, my name's John Corlett. I'm the president of the Center for Community Solutions. Happy to be here today. I think we feel a little bit of sense of urgency about this. In fact, we do feel a sense of urgency about this because obviously the Supreme Court decision was at the end of June. Ohio has, shortly thereafter implemented a law that outlaws abortion after 6 weeks, which largely makes it illegal in the state. And we know that there were 6,500 women in the last year, this is data from the Ohio Department of Health, who terminated a pregnancy who are from Cuyahoga County. So we have women today, this weekend, who are being turned away and are gonna, and I think, putting the question of abortion aside, I'm more worried about, because I think a lot of these women are gonna deliver in Cuyahoga County. And so I worry about all the services that we need to wrap around these individuals. We already today don't have enough infant child care. We don't, our child welfare system is under stress. Everything about the Health and Human Services system is under stress. We haven't, sort of formulated all of the strategies around this because actually we want to bring people around a table and say, tell us what this means. What does this mean to our domestic violence system? What does this mean to our child welfare system? What does it mean to our efforts to reduce infant mortality and maternal mortality and reduce disparities? We know all those issues. We've had those for a while, and we know that this decision and the impact of it is going to complicate that. So we've tried to stay out of the abortion debate and sort of more focus on, let's bring people together, let's begin this planning process, because the issues are coming closer to us, that we will have women delivering this fall and winter who weren't able to terminate their pregnancies. So we want to do a planning process first. We think it's really important to Mr. Boyle's point about the law not being settled. I think that's entirely true. I think the law will continue to evolve. I think it is everyone's expectation that, after the election, that there will be an effort to outlaw abortion entirely without any exceptions in the state of Ohio after the fall election in the lame duck session. That is what people are sort of preparing for. That's what the proponents. There's also a bill, to declare a fetus a person, to establish personhood. That has even greater implications for some of our services. One of the things we thought would be important to do as part of this process is bring our health systems together with our human services system to kind of talk through some of these challenges, because we don't understand what they're facing. They don't understand what we're facing on the human services side. But we think there's a great deal to be gained from initiating those conversations and doing it quickly. We did, in this project budget, assume a patient assistance fund, but we haven't, and we sort of, in order to make a budget, we sort of said, well, this might be as 500 women, 500 persons or whatever. But some of that, I think we're going to have to figure out once we begin this planning process, to figure out where do we need it. Because as Ms. Roberts pointed out, there are other parties, other groups, organizations that are sort of getting involved in this as well. The city of Cleveland has made statements about this. So we want to see, we don't want to expend resources where we don't have to, where there may be other players that are picking up some of these costs. But we also, we know today that people face challenges around, exercising these services. One of the first groups I heard from after this decision came down was Adoption Network. They're like, we think we're going to have more demand for our services. And I'm like, I want you to be part of this conversation. I want you to be part of this planning process. So we feel an urgency to get that underway so that we can get started. I think there will be need for education, as we'll need to constantly update people. Your own caseworkers in the county will need to understand what they can and can't do, as will private agencies. So I think that's where we feel the sense of urgency, that this is an issue that's right here, right now, and we've got to get started as a community figuring out how to respond to it.
So I I know you do good work, Mr. Corlett. There's no question about what you do. And the education and even the after fact of childcare and helping those that perhaps didn't plan to have a family now do. Well, that is wonderful conversation. The issue I have here, though, as stated in your documents, is that over half, 278,000, is dedicated towards the transportation and hotel accommodations. There's only one reason why that is being offered, and that is the piece where I think goes outside the educational, the whole dialogue of how can we be helpful to those that find themselves in a different place. When you start talking about the hotel accommodations and the transportation, that's a different type of counseling. And I think that I go back to what we have yet to discuss as a committee, as the committee of the whole. We have not had a chance to talk about that. And that is the only piece. Outside of that, everything else you said I agree with. I think there will be a need for us to understand what is the fallout of all this and what can we do to help those that need the additional help that we may not right now be considering. But it's the other piece that takes it to a different level, I think, without having councils at least a chance to talk about why they think we need this ordinance that is being proposed in the committee of the whole. That's as clear as I can say it.
So let me throw this out there. Are all the council in agreement they want to hold this, or do we have the approval to move forward with this today? I want to make sure we're being respectful of all the board members. So I'm willing to move it forward unless you, Councilman Miller, go ahead.
I would have been willing to support the delay if it were a week or two, but not for what it's looking like. So I'm ready to vote today.
Okay.
And I too would be ready to vote today if we could eliminate the piece of the transportation and hotel accommodations, which is beyond education, and creates a new type of counseling that we as county council have not had a chance to discuss. So I would ask that it be held.
Well, nobody elected me anything. No, I understand that, and I think I'm prepared to vote on it.
Okay, well, let's put it to a vote then. I'll make the motion to approve the item. Do I have a second?
Second.
Second by Ms. Nicole English. All in favor, say aye.
Aye.
Aye. Opposed? Opposed. One opposed. The item's approved. Let's move forward. Next item.
The next item is BC 2022-544, Department of Health and Human Services, Division of Children and Family Services, submitting an RFP exemption, which will result in award recommendation to Group Plan Commission in the amount not to exceed $6,685 for outdoor space rental for Family Fun Day held on Public Square on August 4th, 2022, and recommending an award and enter into a contract with said RFP exemption.
Good morning, Marcos Cortez with Health and Human Services on behalf of Children and Family Services. Again, this is a contract with the Group Plan Commission. This is the organization that runs Public Square. We hosted our Family Fun Day event this year after a couple-year hiatus. The Family Fun Day is to provide fun activities, great resources from our county agencies and partners, and provide backpacks and school supplies to our families. Obviously, this was already held August 4th. There was an issue with our vendor who had not registered in our supplier portal. In order to do a contract, we have to have them registered in the supplier portal. They had great difficulties registering. We provided feedback, we provided IT technical assistance, and they could still not register. So in the end, we actually registered on their behalf, which is not something we normally do, but we needed to move this forward, so we did it.
That was good customer service. Are there any questions on the item?
We did this before, right?
Yeah, it's been, I think it's been on hiatus for 2 years because of COVID, but yeah, the last time was at Public Square as well.
Yeah, I wandered into it, not that I wasn't like invited, I showed up, and it actually was really, it's a good event.
You were more than welcome.
Thank you, in
Walking
retrospect.
again.
Mr. Boyle, was it fun for the Family Fun Day.
I was only there with my wife and we had fun. I guess it's part of the family, so yes, it was fun. I vote yes on fun.
Can you just confirm what the money goes towards?
Yeah,
Just because we have a partnership with the group plan and the city
Yeah,
and.
the majority of the funding goes for the rental of tables and tents and chairs.
Okay.
There is also a portable restroom that's needed to be had on site. There's a permit to block off the street, and there's like an event planner on site that day, and then there's a small administrative fee.
There was face painting, I believe, and also, I believe there were balloons as
I'm
well.
sure there were.
There were.
You won't have to
I
register
just
them.
wanted to be sure we're not paying all to administrative costs of the group plan commission. Those seem legit costs. Thank you.
Any additional comments, Ms. English? Seeing none, okay, I will make a motion to approve the item. Do I have a second?
Second.
Second by Mr. Boyle. All in favor, say aye. Aye. Opposed? The item's approved. Moving on to consent agenda.
Moving on to the consent agenda items, BC 2022-545 through BC 22-547.
It is a pretty short agenda. Let me know if any of you have any questions. Mr. Boyle?
Do we sell the old computer equipment? I mean, what do they do with that?
RET3 takes it, they professionally clean it. In the past, I can remember many years ago, we actually auctioned off our old computers. We made the papers because someone downloaded software and was able to pull up our files. So they professionally swipe and clean these things and reuse them, things like that.
Perfect, thank you.
Yeah, properly disposed. Okay. Did I take care of your, okay, very good. Are there any questions on today's consent agenda? Seeing none, I will make a motion to approve. Do I have a second? Second by Ms. Nicole English. All in favor, say aye.
Aye.
Aye, opposed. The agenda is approved. Moving on to other business.
There's no other business.
Do we happen to have any public comment?
No public comments at this time.
I will make a motion to adjourn. Do I have a second?
Second.
Second by Ms. Nicole English. All in favor to adjourn, say aye.
Aye.
Aye, opposed, we're adjourned. Thank you.